Community Health Worker Training, Cardiovascular Health and Diabetes, Module 9C, Medications. Learning outcomes for this mini-module: explain the reasons for taking medications as the doctor prescribes. List the ways patients can remember to take their medications. Describe ways community health workers can help community members get and take their medicines correctly. What are barriers to taking medications as prescribed? Stop the PowerPoint for just a moment and jot down all the reasons that you can think of why sometimes people do not take their medicines as advised by their doctor. And now see if you can go down that list and jot down ideas that you have about how community health workers might be able to support people in overcoming some of those barriers to taking their medicine as prescribed. So there are a lot of reasons why people don't take their medicine as prescribed. Some of them, you may have come up with some of these, include fear, right? So they're afraid of that the medicine might be too strong for them, or they're afraid of side effects. A lack of acceptance of needing the medicine. This is particularly true for chronic illnesses where somebody may not be having symptoms every day and they think maybe they're all better. Physical limitations. So certain clients may have trouble getting reliable transportation either to the doctor or to the pharmacy to get refills. They may not be able to drive, they may not have social support, or they may need help getting their medicines or getting back and forth to the pharmacy. They may need help even if they have a pharmacy plan that will deliver their medicine, they may need help accessing it. Cost and financial constraints is a big reason why prescription medicines are very expensive. Even if you have coverage, the copays can be hundreds of dollars a month, and some people simply can't afford it. They have to choose between rent and medicine. Sometimes the cost of healthcare services or follow-up is something that they can't afford, and so therefore their refills run out because they haven't seen a doctor recently. In some cases, their religion may prohibit certain medications. Provider issues. So in some cases, a patient may not fully trust their provider, or there may be communication issues where they really don't understand what medicine they need to take and why they need to take it. Sometimes a provider may verbally change the directions of how to take a prescription, or they may forget to refill a prescription, or be unavailable or difficult to reach. So sometimes it's not the patient's fault, right? They're taking it the way the provider may have told them in the office, but the directions haven't been changed on paper, or vice versa. Sometimes patients have a lack of motivation, and they have difficulty staying motivated. This is true especially of chronic medicine. Time management issues can get in the way. So some people may simply be forgetful. They may forget to take their medicine. They may not plan well in advance, and so they run out, and they don't get refills before they run out. Lack of knowledge. They may not understand how to take a medication correctly, how frequently to take it, or how many to take, or why they're taking it. They may stop taking it if they have side effects, even if they're expected side effects. Or they may not fully understand the benefit of taking the medicine or the consequence of not taking it. And finally, if the side effects are severe, they may stop taking it rather than talking to the doctor or the nurse to see if either the dose can be changed or maybe a different type of medicine can do the same thing. Other times people have other fears or beliefs or concerns that get in the way of them taking their medicine correctly. And unless they verbalize these, nobody can address them with the client. Why is it important to take medications as the doctor prescribes? Well, there's a lot of reasons. Taking the medication correctly reduces the risk of developing heart disease, heart attack, or stroke. Reduces the risk of disability from heart disease, such as weakness or not being able to carry out normal activities, and the risk of dying from heart disease. It can help control blood pressure in people who have high blood pressure, and therefore reduce the side effects or the potential consequences of that. It can help control cholesterol in people who have high cholesterol, again, decreasing the risk of stroke or heart attack. It can help control blood sugar levels in people who have diabetes and therefore help to prevent complications of diabetes, such as kidney disease, blindness, or problems with the nerves, gums, or feet. And some of those problems can even lead to a need for amputation. Another important reason to take medications, as the doctor advises, is that you can be a good role model for other family members who also need to take medications. What if the doctor prescribes more than one medication? When the doctor prescribes more than one medicine, it's important to take them all as prescribed. Ask questions if you have any concerns about taking more than one medicine. Medicines work best when taken as specifically prescribed by the doctor. It's also really important to tell the doctor about any other medicines that you're taking. Some people have more than one doctor, and different doctors prescribe different things. And unless you tell them what else you've been prescribed, they won't know. And they need to know that to make sure there aren't any interactions that they need to be aware of. And remember, when we're talking about telling your doctor about medicine, we're not only talking about prescription medicines, but over-the-counter medicines, herbal medicines, and anything else that you're taking to help treat a condition. It's really important that clients keep enough medicine on hand so they don't run out. Some medicines in particular, it's very dangerous to skip even one day or one dose. So to help clients keep enough medicine on hand, you want to help them keep prescriptions filled at all times, and help them to refill prescriptions before they run out. So that may involve helping them set up some kind of a calendar or a reminder to remind them that it's time to get a refill. Or even you can set it up at the pharmacy, that the pharmacy refills it automatically and sends the client a reminder. It's also important for clients to have enough of their medicines in case of bad weather, right? So in the middle of the winter, if they can't get out to a pharmacy, they need to have enough on hand. Or if they're going on a holiday, if they're going away on a vacation, they need to have enough to be able to take with them. Again, if they go on a trip, make sure to fill enough of the prescriptions to bring with. And also it's important to know what the pharmacy's hours are, so that, if you're running out of a refill and you don't try to go until 10 o'clock at night and it's closed, you're kind of stuck. What if I can't afford my medicine? If the cost of your medicine is a problem for you, tell the doctor. The doctor may be able to prescribe other medicines for you that cost less. Some medicines have a generic form that costs less than the brand name form. You may also be able to lower your cost by comparing prices at different pharmacies. You can speak to a pharmacist about whether there's a comparable medicine that your doctor could prescribe, and the pharmacist can then call your doctor and talk to him about it. You may also be able to talk to a social worker while you're at the hospital or at the health clinic, who may be able to help you figure out ways to afford your medicine. The social worker will know about programs that can help you pay and whether or not you might qualify. And community health workers can help patients find low-cost or free medication programs. Here's an example of some medication programs. Some pharmaceutical companies also have programs to help patients pay for their particular medicines. So if the client is going to a community health center, often the social worker there will really know kind of how to help them get their medicines. If they're going to a private doctor, oftentimes that service is not available to them, and community health workers can really play an important role in that case. Who can help advise clients about their medications? The pharmacist, who's the person at the pharmacy trained to help you with your medicines, is probably the best person to talk to, as well as your doctor and nurse. They can help answer questions about your medicines. Certain other licensed healthcare professionals may be able to be helpful if they are part of your healthcare team. If you have a question, the easiest way may be to ask the pharmacist. The medicine will also come with printed information about possible side effects. For example, some diabetes medicines can cause an upset stomach, and some blood pressure medicines can cause leg cramps or cold hands and feet. Tell your doctor if you think a medicine you're taking is causing a side effect. Don't just stop the medicine. Okay, call the doctor or the nurse and talk to them about the side effect, and they will give you advice about whether they want you to continue or to change the dose, or whether they will change the medicine for you. The medicine will also come with warnings not to take it if you have certain conditions, such as allergies to certain medicines or chemicals, or if you're pregnant. The medicine may also come with directions for taking it, such as taking it at a certain time, or staying away from certain foods or other medicines while you're on it. Ask your doctor or pharmacist to let you know if you need lab tests from time to time to check how your medicines are working. That completely depends on what medicine it is. You want to be sure not to get advice about your medicines from the internet or your neighbor or your mother-in-law, other people in your family. That is a common place where people go when they have questions or concerns about their medicine. And unfortunately, unless your neighbor or your mother-in-law happens to be a pharmacist or a doctor, sometimes the information they give may not be accurate. And that goes for the internet as well. Do not want to get information about your medicines from the internet. You want to talk directly to a pharmacist or to your doctor. Community health workers can really do a lot to help people take their medicines regularly and correctly. Sometimes a client may not be comfortable or may be embarrassed disclosing to their healthcare team that they can't afford their medicine, or that they're so forgetful they are forgetting to take it. And sometimes community health workers have a closer bond with the client and can really help them problem solve to try to address those issues. So take a minute now and think about specific things that community health workers could do to help community members get their medications and take them correctly and on time. So think about the issues of forgetting, of having trouble affording them, of not understanding why they should take their medicine or how they should take their medicine, and what could community health workers do in those cases. During our class, we'll talk about the ideas that you came up with in terms of what community health workers can do to help support people to take their medicine correctly. Now you can explain the reasons for taking medications as the doctor prescribes, list the ways patients can remember to take their medications, and describe ways community health workers can help community members get and take their medicine correctly. Congratulations on completing Module 9. The next module, Module 10, is Mental Health and Wellness. Now don't forget to go to the Google Classroom to complete the assessment for Module 9, Patient-Driven Healthcare.